That's a good question because I think it has shifted to behavioral health from like mental health or alcohol and drug because it's one person. And so there's different ways that issues can affect how people live or how they get along in life and get along with people. And often different disorders come out in behaviors. So I'm thinking that's maybe why we went to a more holistic behavioral health term. So I went to Metropolitan State College of Denver. It is now Metropolitan State University. So I got a bachelor's degree in psychology with a minor's in women's studies. I was fortunate enough to get a job even before I graduated as a milieu counselor at a psychiatric hospital for residential treatment for adjudicated youth. People kind of taken out of the home into DHS custody, and it was a treatment center. And I kind of had this illusion of like, I can do this for a couple of years and get back into grad school. That is hard work. It's very important work, but about 2 months in, I'm like registering for graduate school because I realized there's no way I'm gonna stretch this out for a 4-year plan. So I got into graduate school after working frontline staff in a treatment center. Yeah, I'm probably one of the more unusual people. I actually researched the different degrees in mental health or psychology. And the reason I chose my degree, because like for a master's of social work, they have a much more emphasis on systems and policy. There is a clinical emphasis, but then there was marriage and family therapy. That just wasn't quite what I was looking for. And then the licensed professional counselor track was attractive to me because of the clinical aspects and kind of the broader structure of, the possibilities in there. So I chose to go through the counseling track versus some of the other degree fields. They have some strengths. Masters of social work can work for the federal system almost exclusively. Things are changing, obviously. We have a workforce shortage, but that Masters of social work has school opportunities, like being a school social worker. Again, the federal system, medical system really gravitates towards that Masters of social work. But I still ultimately chose a clinical path with licensed professional counselor track. We're responsible for defining and developing the treatment that's delivered in the facilities to the clients, which are offenders with the prison system. So the program administrators, set the standards of care and train the clinicians and follow up for those treatment programs in our entire state prison system. I think my favorite part of my work is the clinical consultation that I have with program administrators, therapists, supervisors, and a larger MDT. That's a multidisciplinary team. We work with other disciplines like correctional officers and case managers and even medical personnel to really kind of get a nice, thorough clinical picture of individuals so that we can plan treatment interventions that are hopefully effective for them. So that clinical consultation is really what keeps me going. At this level, I can offer a different perspective than the person on the field, just in it. They can't always see the forest through the trees. I'm able to give that perspective, and that is very, very fulfilling. I think in the counseling or behavioral health field, some of the challenges is that our clients really struggle, and it's hard to witness that struggle. Sometimes they're able and willing to progress, other times they're not, and it's really a challenge to see people struggle In this particular field in corrections, the manner in which these clients struggle is extreme. I've never seen it in another work environment that I've been in. So it can be impactful that way, and that's why there's clinical supervision and consultation, so that we can keep that perspective, but still honor the fact that it was pretty impactful. At the Colorado Department of Corrections, we have similar positions as what community-based organizations would have, whether that's a community mental health center or a more smaller agency or a hospital setting. So like for substance use disorder treatment, there's a couple different positions in there that don't require a master's degree. So that's a really good place to start with the certified addiction technician or the certified addiction specialist that requires a bachelor's degree. That can help people get into the field, get some experience, and see where they want to go from there. The other part we have is when you get into a master's degree, there's the unlicensed psychotherapist positions that you're still having a caseload, performing all the clinical treatment services, but you have clinical supervision and oversight from more experienced licensed clinicians. So we then have those licensed clinicians, whether it's a licensed clinical social worker, licensed professional counselor, or that licensed marriage and family therapist. There's also a licensed addiction counselor. So those individuals have had additional coursework, passed tests, and have gotten registered and licensed through DORA, the Department of Occupation Registrations through the state. So then we have psychologists who are actual doctorates. They have either a PsyD or a PhD, and they can be licensed as well. So we have a spectrum of professionals that can work in the behavioral health treatment field. So I think in the beginning of education, whether it's like an associate's degree into a bachelor's degree in psychology, there's a lot of theory and very broad strokes about the different aspects of psychology. Psychology is not specific to counseling per se. It's about, the human brain and those type of things. So it gets a very broad stroke at that bachelor's level. At the master's level, you go into those theories even further, and then how they're applied and how we practice with them. So part of a master's program, we have an internship, and that's where you're still a student, but you're actually working with trained professionals doing that skills with clients. So you have a very practical experience again as you're earning that degree. I would definitely try and talk to somebody who's working in the field, because I think, I remember I'm a very pragmatic person, and when I was in high school, people talked about wanting to be a child psychologist. Again, working, my family's in the medical field, I was like, that's a doctorate degree. You know how many years of education that is. And I kind of knew even then that that's not always a practical thing. And so just really kind of understanding what you can do at what level. And that's why I mentioned that certified addiction technician that doesn't require a bachelor degree, and you can start working in the field sooner and really get to know what you want to do or would like to do, or if it's even for you. Often in school programs, college programs, there's what's called a practicum, and that's essentially where you go to these sites and you're an observer. And so you're able to see what a day in a life may be, and there's a lot more paperwork than what people really tend to want to do, but it is a very important aspect because you have the privilege of holding that person's progress in that record. So I really try and look at that paperwork aspect as helping that client go along.